Thank you. Good morning. I'm Harrison Pierce, Chairman of the Health and Human Services Commission. And just as a reminder, if you would please introduce yourself before speaking. Thank you again for the attendance. Most of us are here. Yes, Jim Lisher did have a total knee replacement. Hopefully, I don't know if you're tuned in or not, Jim, probably not. Hopefully he's doing well and we wish him a speedy recovery. The first item on the agenda is approval of the minutes, November 4th. Any questions or corrections? Thank you, Alyssa. Again, may I please have a motion to approve the minutes as are?
I move.
Any opposed? Thank you. All in favor, please note that in the minutes. We will defer the 2022 calendar until next month. Next reports, Health Department, Jen Eielson. Jen?
Jen Eielson, Director of Health, Town of New Canaan. I guess we'll start with a vaccination update. DPH updated the data as of November 24th, the day before Thanksgiving. They added the 5 to 11-year-old group that, we just started 3 weeks ago, roughly. So the ages 5 to 11, this is with at least one dose, 42.99%. 12 to 17 years old, 99.5%. 18 to 24, 100%, 25 to 44, 100%, 45 to 64, 91.53%, 65 and over, 100%. Percent of total population, this includes even those that are ineligible, with at least one dose, we're at 82.36%. Percent of total eligible population, so this is now 5 and up, with at least one dose, all ages, 87.9%. Percent of population fully vaccinated, we're at 73.41%. Total doses administered to date by the health department, 17,519. Last month, we did the first dose clinic for November 11th for New Canaan High School. We did 927 kids. Today is the second dose clinic for that. So we'll have the second dose, and then we added another 100 slots for first dose today as well. Just try to keep folding in the other kids we got to get to. We did the country school clinic on the 17th. We did 230 kids there. On November 10th, we did a teacher booster clinic, which we did over 300 teachers at the high school. The second dose clinic, like I said, is tonight at the high school from that November 11th clinic. We held a mini pediatric clinic last Wednesday, the day before Thanksgiving, because it was a half day from school. So we did a clinic at Vine from 1 to 6 o'clock at night. So we did another 120 kids then. That wasn't included in those numbers because DPH is like a week behind essentially. So that number and in tonight's will not be included in tonight's updated numbers that the state will give. Yesterday they did St. A's. We had a very low turnout with St. A's, less than 20, but we offered it to them and we went. The second dose clinic for the country school is next Wednesday at the country school. And I just want to thank Bethany and Harrison for all their help, especially with some of the more difficult children in some of these clinics. It's been a little abusive, but make it work.
Thank you to you, Jen. My son got vaccinated at the one at New Canaan High School, and it was, for those of you who didn't get to be there, truly amazing. I mean, they had a balloon guy, they had toys for the kids, they had candy. If you can imagine that number of kids getting vaccines, And it was pretty calm and a happy environment, and run so smoothly. All the EMS volunteers, I mean, all the volunteers, it was fantastic. So thank you so much. And I did see Bethany and Dr. Pierce there too, but thank you. And
Thank
we're very,
you,
very
Alicia.
excited to come back
you.
tonight
No,
and
it-
get number 2.
It all has been so well organized, and I think Jen deserves the credit, almost all of it, if not all of it, for that. Also, she was going to pay out of pocket for those balloons. And Carl did step in, so I guess we should acknowledge that.
Yeah, Steve Carl from Carl Chevrolet caught wind that I paid for the balloon guy and all the treats and everything out of my own pocket. So Steve Carl and Carl Chevrolet graciously are going to be absorbing all that cost. So I thank them greatly for that.
But
So
also
for
thank
reminding
you
me.
for that you were willing to do that, because that really made a huge difference. The kids were so excited. So thank you.
It was
very
like a
much.
little self-preservation mode at that point, because I'm like, what can I do to make 1,000 screaming children not be screaming? So the balloon guy, he probably wasn't very happy by the end of the night, but he did great. He stayed to 8:30 and it was great. His daughter made a lot of tips, so that was great. And I'm glad the kids were great. Next week we're doing Monday and Tuesday at Vine. We're doing mini clinics of boosters. We are just getting pummeled with phone calls and emails for boosters. So they're going to be in Kevin's out call tonight. Well, we've already been adding people into it. So Monday, Tuesday at Vine with my nurse, Amy. Wednesday at the country school for second dose. Thursday at Irwin with a bigger booster clinic that's been full now for 2 weeks. And then the following Monday, we're going to do another pediatric clinic at the health department, because it seems to work well at Vine with Maria and Renee and Amy here, because it's a more quiet, homey environment too. So I think that helps as well. For testing, we're back still at the twice a week, except for Thanksgiving, of course. Thank you to Waveney and Russ for still being our partners with the PCR testing. It's been very full the last couple of weeks, as you can imagine, with the holidays, which we kind of expected, and the traveling. So it's good news that people are still testing and still, heeding the warnings. The total tested to date is 1,111 since August, the end of August. We're still doing a lot of rapid testing in the office too. Just did a couple kids before school today to make sure it wasn't COVID, that there were symptoms they had. So
Thank you, Jen.
yeah, so it's working out well. DPH notified me about 10 days ago that we're going to be getting another grant. It's ELC2. I already submitted it because they only gave you like a week to submit it. It's specifically for contact tracing and vaccinations. And the grant total amount awarded is $74,344.98. The grant runs from March 2022 to May of 2023. So that's already been submitted. I'm just waiting on DPH to send the final contract that Kevin and I can sign. And that will cover my nurse, Renee and Maria, that I've been using part-time. So instead of the town paying for it, it'll just come right out of DPH. And that's till May 2023. So you got another year and a half. And that will be in this year's budget as well. And speaking of budget, we submitted our department budgets this week. So we're just waiting on our individual meetings, but that's all been submitted as well. Restaurant relicensing has been underway. They had till December 1st, so yesterday, to submit, or they incur a late fee. So 64 out of 93 of them submitted. So those now that submit have to pay a late fee, and they have until December 31st. And after December 31st, their license is, suspended until they give us what we need. The septic plans and septic installations are still on the rise. Our revenue is again trending ahead of schedule and above years past. So it's a perfect storm for us. Everything keeps getting more and more and more. And building permits are still on the rise as well. So our main focus, though, is going to be trying to add in the next couple weeks more of the mini pediatric clinics here while doing the bigger booster clinics at Irwin. And so we can keep chipping away at those numbers to keep driving up, especially with Christmas coming. There's a lot of people that, will want to get their kids in. So again, thank you to Bethany and Harrison for all your help with the team.
And a
Make it
couple
easy.
questions. The grant that for 74,000 is that going to be enough to carry to cover your RN for that period of time?
They're 2 part-time nurses at 15 hours per week. So there's no benefits involved or anything. And the way and then my nurse Amy's a separate grant. So they're not 2 grants. They're not covered over, I mean. So it will be enough to cover all 3 of them part-time to try to shimmy around hours. So it's not a full-time person.
Gotcha. Did you submit in your budget for a full-time RN? I mean, because I think the committee, at least myself, would have supported that.
Not in the town budget. No.
Okay.
But
We
it's
were
something that-
given guidance from the Board of Finance that we have to stay under, so we would go over. I mean, something I could still add. I haven't even had my meeting yet. So that's definitely something I could still do. If I have support of HHS, of course.
I'm just sensing that if thinking of the variants that are be coming down and the genomal changes for the variants, having the part-timers on grants to help out in these areas is great, but it seems to me that the town should look at, and I would be one to raise my hand to make the motion to support submission. Money's in there for a nurse to support not only all the vaccinations, but all the other things that are going on in town.
Yeah, and speaking with DPH yesterday, I finalized the Connecticut vaccine program, which is the whole separate vaccination program of the pediatric vaccines of MMR, flu, et cetera, DTaP, whatever. So that's all been finalized and thinking about maybe January or so launching that.
Yeah,
And all that vaccine is free from the state health department.
yeah. Do we have, this with the situation with COVID is uncertain, to put it mildly. And should we have a provision in the budget that we have available funds if we need them to beef up the staff in the health department should the case arise? Because the chances of that aren't 0 or near 0, but it's not a guarantee either. So I could see why you don't want to allocate the money right now. But it should be a contingency fund that's accessible should the need arise. And I don't know if our budgeting process.
Well, yeah,
does
the
that.
way it's been working since probably the beginning of August, when Delta in July started to peak and we were getting overwhelmed again, Kevin gave me COVID accounts. So I've been using those to pay Renee and Maria, the nurses, to come in to help with the other nurse. So the
Okay.
town hasn't said, no, you can't do this. And I have, the other part-time admins that help out as needed as well out of the COVID accounts. So I must give them that. They have been supportive.
Good, okay. Jen, what was the number of new cases reported in New Canaan last week? Did you mention that?
No, let me see. Let's see. So last week we had a total of 28 cases. So far this week we have 24. So it's been trending about the same. We had 30 the week before that, and then 21 the week before that. So we've been hovering around this 30 now for a couple of weeks, but
Yeah.
we don't know what's going to happen. Time will tell.
No, and the state of Connecticut has seen a big increase in the last month or so. We were running 300 or 400 a week or day rather, and now we're running about 1,000 a day or close. So I gather it's not here, but it's somewhere in our state. So And a number of other states are showing similar upticks, so.
Well, and with the holidays, it's to be somewhat
Yeah.
expected to have, upticks.
Right.
Like we probably don't even have the Thanksgiving uptick yet, to
Right.
be honest.
Yeah.
It could be this weekend that it's coming. Jeez, sorry. And our phones don't stop. But no, so right now we're okay. We're not having, like Darien had, so we're okay so far.
Thank you.
Yeah, just a little hospital update. Norwalk and Stanford are running about 5 COVID patients each. Again, the majority are not vaccinated. I saw statistics and heard recently that if you're not vaccinated, you're 6 times as likely to get COVID and 12 times as likely to die, for morbid numbers. And the post-infectious immunities, seems to wane faster with the disease and with the vaccine, which is always an interesting thing, probably up for argument or discussion further down the road. So we're doing Pfizer with all the kids. Moderna, Jen, I think is at the end of the year for the 5 to 18-year-old grouping. I mean, the 5 to 11. Unmute. Jen, unmute.
They haven't even approved the Moderna 12 to 17 yet.
Okay.
So
All right, yeah, I think-
Moderna's like way kind of behind this all.
All right. Yeah, I saw that recently. Anyway, okay, so that's great. Thank you, Jen. Next on the agenda, Human Services Department, Bethany.
Hi, I'm Bethany Zarro, Director for Human Services for New Canaan, and I'll start out with the food pantry. We have an uptick in usage for the food pantry, but it does double during the holiday season. So we're on track with the numbers there. Amazing St. Aloysius food drive. We received over 400 full bags of food and
Wow.
gift cards. Absolutely amazing. And then the organizing of it afterwards was just as incredible with the food pantry volunteers, the DAR, Daughters of the American Republic, NCL, slobs, and everything was put together on Monday for Tuesday's distribution. So it was incredible. Farmers market season ended for the vouchers. And so we're reconciling with the vendors and we'll see how much, and if it was still worth it to continue this type of service for the food pantry. Holiday programs, $50 gift card per child from either Amazon or Walmart. It's up to the parent's choice. Each child will receive the card at the the parent will receive the card at the December 7th food pantry distribution. PEO chapters, New Canaan moms have been incredible with and also the residents with their generosity in supporting these gift cards. December 21st will be the holiday meal and gift card for the for Christmas or whatever holiday that's being observed. And the Realtors Association is has been completely involved with all of this as well. Coat drive was successful. That was done. PD and fire did a successful coat drive. We are now giving those out at the food pantry. People are very grateful as their children grow each year and they need a new coat, as well as their adult coats too. Fire department donated Walter Stewart's Thanksgiving meals. And so they were delivered to the homebound. People were very, very grateful for that. We delivered those. And the police department, their next endeavor is doing a food drive and a hat and glove drive. And that will be distributed at the food pantry as well. Donations through the general public and area organizations for fuel, gift cards, food, as I said, has been beyond generous. Christmas trees, fire department, Chamber of Commerce, Garden Club have all donated. And this week and next week, they are being received and then sent out to the clients. Flu clinics. I'm down. Sorry, Jen, but I am down to 3, to very few. Vaccine left from what we ordered, and the COVID clinics, Human Services is helping out doing first responders and staff as needed for the health department. I take Jen's orders and we're doing that. The budget, fast forward, there are no real changes. We're tweaking the budget where we see we're not using as much money for expenses, for meetings, etc. We really cut back on a lot of things. And I think that will do it for now. Marcy and Jackie have their reports, but Jackie had an emergency meeting with the Board of Ed and a family. So Harrison, if I could go into her quick
Yes, go ahead. Thank you.
recap. So she's meeting right now with the Board of Ed, admin, and a family for a situation. She's had a lot of new family referrals, 4 domestic violence reports. She's waiting certification on a few of the fuel assistance applications. The credit special assistance department at Eversource has been super helpful with electric and gas heat clients. Millport and Canaan Parish they're switching over to different energy bills, and it's been monumental for many of these clients with their fuel energy assistance awards, and they've got to switch it over. So anyway, Marcy will go more into that. There's
Bethany,
been
what, for the 4 domestic violence, over what period of time was that?
since the last meeting that we
Since our
had,
last meeting?
last Human Service Commission, Health and Human, yeah.
Thank
So
you.
for the month of November, we'll go through it that way. She's received a referral from Kids in Crisis and the police. She's working with a family there. Kids in Crisis is supporting a few families for the holidays that have not updated their financials here. We just can't say, oh, well, we really are very adamant about having to update a financial. And so we will get those financials in, but at the same time, if they do need help, person to person and Kids in Crisis can help as well. And then we have the wish list families and kids that she's getting the numbers for the gift cards. And as the financials update, we'll have more families come into there. All the trees have been assigned, 16 trees. And there 3 seniors will be getting the trees. A lot of the seniors, we try to split them up, but they really don't want a tree. It's just too much. So most of the families will be getting those. 13 of the 16 will be going to families. And that's it from Jackie. And once again, I just highly praise and am thankful for both Jackie and Marcy and Enza for working with all these families and making transitions into other avenues and changes, making it as easy as possible and giving them as many resources as possible to make their situation a little better. Okay, that's it.
Alyssa
I'll
McKenzie.
second.
Oops, sorry.
Yes,
No,
Alyssa.
I'll just
Yeah.
second what Bethany said in reference to Enza, Marcy, and Jackie, and herself.
Yes.
Um,
Third, Alyssa McKenzie, Commissioner. Can I just add one thing, Russell, that I thought was interesting in the November abuse prevention partnership meeting that takes place on the 2nd Thursday of the month. One thing that I thought was interesting about the domestic violence cases was they were actually happy to see more cases because that meant that all the outreach was working. And so I thought that was another
Great
thing to
point.
be
Yeah.
proud of.
Yeah, exactly. There might domestic violence, the stigma or the reassurance that help is there is definitely helping with people asking for help. And I,
No,
yeah,
I agree, Alyssa. I mean, it is very underreported,
yeah,
as we would say. And certainly, I think all the education, I think, has helped take away that stigma. So that's wonderful. I love to see it continually tracked when the education programs occur, and do we see an immediate rise? But that's an area that, as a community, we should all be concerned with. And I think we've done a great job and removing that stigma, and just tracking to see if there's additional resources that we should be allocating for that. So thank you all for that. And I concur with Harrison. You guys are all doing a terrific job, and we appreciate, as a commission, but also as residents of the town, the job you guys are doing. So thank you all.
yeah. It's our
Here,
pleasure.
here.
Thank you.
Thank you.
Next item on the agenda is Marcy with Adult and Senior Services.
Good morning. I am Marcy Rand, the Adult and Senior Services Coordinator. I am continuing to work with the police and protective services. I've gotten 2 new referrals for some vulnerable residents here in town over the last 2 weeks. I have also attended a conservatorship hearing that was successful. There was a court-appointed conservator for this resident, and she was really concerned for us, and she's in a much better position now to receive the care that she needs. As far as the protective services cases, I am also getting phone calls from Nuvance, Norwalk Hospital psych social workers. They have been fantastic in reaching out about residents who have been admitted or that they're concerned about. And we have been coordinating getting them services. So that's been fantastic. Energy assistance, as Bethany said, is continuing. To date, I've helped 21 residents get certified. On average, those certification awards are about $550 to $600 each. And that will continue for a couple more months. Coffee with a Cop continues to be great. We had 20 residents come in 3 weeks ago to listen to a scam prevention program. And next week, Officer Bartuli and Officer Coughlin will be doing a program on safety preparedness during winter storms, what to have on hand and driving and all that kind of stuff. So that's going to be a good presentation. That's next Thursday. And then in 2 weeks, my Life Reimagined group is going to be held again. And so far 16 people have been signed up for that. So that seems to be a success, which we're thrilled about. And that, I think, is about it.
Marcy,
Mhm.
could you what is Life Reimagined group? Remind me what that is.
It's a group that another social worker, Robin Rockefeller, she's a retired social worker who continues to hold her license. And she and I are doing a group at Lapham just for, it's been a hard year and a half. So there are a lot of seniors who sort of even have retired and don't really know what to do with their lives kind of thing. And it's been really great. Like we've been talking about, things that they used to enjoy doing that they now can have time to do. And there are ways of dealing with loneliness that's not just over Zoom. And it's been great. It started out small with 6 people and it's growing. So there's obviously a need for some a connection with somebody.
Thank you.
Great.
Thank you, Marcy.
Yep.
Next item, old business, 1 Kids in Crisis. The reports about Greg Sloan, who's at New Canaan High School, are very positive, and it's good to have him in place. Saks, they are still searching for a counselor there. They have had 2 candidates. One did not work out, and the other one was looking positive, but decided to extend her maternity leave and not enter the job market. So they're back to square one. The American Rescue Plan Act, and we discussed with Kevin mental health, et cetera. that's all in the works. There are many issues, many requests for funding. He said it'll be over the next month or two. They're dealing with each thing in a piecemeal fashion. And so we don't know where that will end up. The Health and Human Services contribution to the alcohol and drug awareness with the advertisements are in place. It's weekly in the New Canaan Advertiser. Alyssa has contacted New Canaan too to do it there. And and special thoughts and thanks to Lance Minor, whose term is coming to an end, but he was very involved with this. And you know, the names of the commission members are there, including Lance, so that's a good thing. The next item is new business on the agenda. Holiday gifts. Bethany?
The holiday gifts, we're wanting to ask the commission if they are interested in delivering, whether together or person, one or two. What we do each year, a plant, poinsettia, and a small box of cookies to the homebound. It's very much appreciated and just sends off, good feelings to those that are a little isolated. So that being said, anybody interested, you want to take a vote, and then Enzo will get together with Marcy in terms of logistics.
Yeah, I think that's
Happy
a
to do
good
it.
thing. It's good for the recipients as well as the commissioners. So yeah, I think we'll have a cadre of doing it.
And it's
then
not a
the-
visit, it's just to drop off at the door.
Yeah.
We're not entering into their house.
Unless they may, some of them want to talk for a while, so.
Okay,
It varies.
it varies.
They do
I'm
like
happy
the
to do
visitors.
some of
We'll
those.
be masked and we can stay outside or do whatever seems appropriate. given
Whatever is
situation.
appropriate, yeah, and we can sort of
Great.
give you a guideline as well as, what they're expecting. But it would be, you can go together or separate, as I said. If you go together, we probably would do two. If you go separately, I would just do one, so. But it's a good feel, good deed.
How many people, Bethany, do we expect to?
We can go, it depends. I'm thinking probably 15.
Okay.
Maybe. Yeah,
Yeah, I know a couple of years ago it was 10, 15, that's the neighborhood. And
yeah,
so we will let you know when and where.
yeah,
Great.
we'll get that organized again.
Great.
Okay. Next
Um,
item on the agenda are the draft requests.
All right, so you received in your email the attachments. This is the same time this as last year. There are 6 agencies in New Canaan that do need help, request money for their yearly involvement in the town. And once again, the money that they've asked is always the same as the year before, and we've always given the same. I have put down on the budget that I submitted for last week to Lunda, who's head of finance right now, CFO. And it came back where he approved the request. So now has to be passed by the commission. So if we can go through, we're making it, very easy. If there haven't been any changes since last year with the organization, Community Health Center, which is the
Bethany,
Child
before you-
Guidance Center.
Can I interrupt just for a moment? I apologize.
Sure.
How much money in total has the commission been allotted for this?
Well, we are requesting 174,000, which is the exact same as last year for these other agencies, outside agencies.
Okay, and did we send out any kind of RFP, or is this something?
Yeah,
that
so
they
what
know?
I do is, yes, so last couple months ago, I sent out an RFP saying if you're interested, and I only send them out to those from the previous year. I don't do a mass mailing. These are organizations that we benefit, the Health and Human Service Commission benefits from for the residents in town. And so the Child Guidance Center of Southern Connecticut is the first one. They have requested $5,000 again. So historically, I have the actual fiscal years from 2018, 2017, 2018, and we have consistently given 5,000. The next one is the Domestic Violence Center. They are requesting 10,000 this year. They do always request that amount, and we usually give them 5,000 since 2017, 18. We have given them 5,000. I don't know if you want me to go through these really quickly and then vote on them separately, or as a whole, maintaining the same numbers that we used last year.
We can vote at the end unless there are questions.
Unless there are questions. So the domestic violence, they asked 10,000 again, and we can give them the 5,000 that we normally do. The next one is the Get About. They are requesting 50,000, and I am 46,000 is what we have given each year. They do get grants from the state, and we have put in for the ARPA possibility of a new van, things like that. So the 46,000 we have been giving since fiscal 2018. Kids in Crisis, they are requesting 85,000 this year. Last year, they requested 90 and received it. This year, they're requesting 85,000. Meals on Wheels, they're requesting the usual.
Bethany, the 85,000 goes to pay for the counselor at the school. That's
At the high school, correct. Yeah.
Right.
Yeah.
Okay.
So, and then the Meals on Wheels, they've asked 5,000 again. We've historically given them that. And New Canaan Cares, they are asking 21,000. We usually give them 18. They always ask a little bit more than we give them, but we've been 18,000. So those are the 6 agencies that we do work with on a year-round basis, and then the residents do benefit from us granting them money, and we're able to use them for resources for our families and individuals.
Bethany, I might have missed something. Do they all tie into like 174,000 or?
Yes, this equals, so actually this year with it's really 169,000. I am requesting that the commission pass, that we give. The other one is community program mental wellness. That is our 5,000 that we put away just in case we need to do any type of public service announcements or training, things like that. That's included in the 169,000, an additional 5,000 that goes into a line item for the human services.
So if something else were to come along, we would only have the 5,000 left in the kitty.
In the
Is that
kitty, and that's what we've had
Okay.
once again since 2018. The for example, the vigil, the addiction mental health vigil that Paul Reinhardt does, we always sponsor that, giving them. Last year we gave $2,500 because we had that much left from the year before. So I sort of, it's things like that. It's public service announcements and just sponsoring some of these major events that happen in town.
Bethany, I have a question. If they find a kids in crisis counselor for Saks Middle School, who's paying for that?
So a good question, Alicia. This is right now, the Board of Ed is paying for the kids in crisis counselor with their ARPA funds for the next 2 years.
Okay.
At that point, so in another year, I will be asking, we do have to look at that seriously. Was it effective? Should we continue that? That will be something that will be handed over to the Health and Human Service Commission to look at and to see, if we want to continue, the grant will basically double. But that's 2 years down the road. But yeah, we do have to think about that, and that will be submitted to the commission for advisory purposes.
Are the Get About vans, and maybe I'm unclear on this, are they now owned by the town and all the insurance coverage?
Yes,
by
so
the
the Get
town?
About still, yeah, the town covers the insurance, which is, it used to be like, I think 30,000-40,000 a year when the Get About was under the Get About, and now it's like 1,500. So that was a huge savings that Kevin Moynihan set up, that the Get About go under the town. As a result, there's still the vans, they, every year, what they're trying to do is the vans, it's about $50,000-$60,000 for a van. And that's a huge, hit that they take, and they're trying to keep that going every single year. So the state grants, which I submit for, they get about 26,000 each year from the state for the Get About, because it is public transportation for the disabled and those 60 years old and over. So this 46,000, they use it. I'm ex officio on the board, and every month, going through their financials and everything, between anything from accidents. They do have cars hit them, and the type mechanical servicing, it all adds up. So, and they do a lot of fundraising. They really try, but it's an older person that donates. It's a little more conservative. So this 46,000 from the town, I'm a huge proponent. It is our only transportation. So that's why.
Other than the drivers, Bethany, they have one employee who is mostly a dispatcher, right? So it's a
Right,
very lean operation.
it is so lean.
Yeah.
Yeah, and it's just the town, really, the benefit is incredible, and I would hate to give them less, only because that I don't know where else they can skim to get down to whatever their costs are. During COVID, they did try to keep the drivers, going, and they are up almost to pre-COVID levels now of usage for the residents. So it's coming back into play, and it's a tough organization to keep going. So the 46,000, they asked for 50. We could take, since we're 5,000 under budget, we could give them, since Kids in Crisis asked for 5,000 less this year, we could give them 5,000 more. I don't know what you want to do, but they're very grateful for the 46,000.
Well, I at risk of, trying to evaluate who deserves more money in allocations, it's a difficult
Totally, yeah.
thing to do in terms of priority. You could argue that, with the increase in domestic violence based upon the education, everything, that we should have more money there to support. It's one thing to educate and tell people there's services there, and then we don't have the money there to support it. Get About, I agree with you. It is a great service. I've not looked at, buying a vehicle versus leasing a vehicle versus how many fleets of vehicles that they have and what the demand is. So we're really, for me as a commissioner, Russ Barksdale, relying on you, Bethany, and your team of kind of putting the matrix together and weighting the matrix and what makes sense. Just because year after year we're doing the exact same amount, I'm not sure that is the more prudent strategy, because priorities have been changing so much lately. I do agree that all these programs are well deserving of our support, so please don't take that away from that. Meals on Wheels, I've somewhat recused myself because we do prepare the meals that get delivered. So I have a conflict there. But everyone acknowledges the great work that they do for those
Yeah.
individuals. So yeah, I mean, I have to rely, me personally as a commissioner, on the priority grid scales that you guys have put together internally and looked at need. I just would like to get away from just the standard, this is what we gave them last year,
Yeah.
to more of a need-based kind of metric, to be able to, maybe heavily weight some programs in certain years and let others know that, we will help them certainly maybe in grant applications additional. But if we are limited to the 174, then we really don't have very much room to allocate different.
Yeah, I
you
mean,
know,
we're,
money.
and Russ, we're not limited. I'm just with the finance saying, they want to keep spending literally at zero, we need to look at that too and honor it. But your points are, well taken. I look at the Get About and domestic violence and Meals on Wheels as more of the older adult and disabled category. I look at Kids in Crisis, New Canaan Cares, and Child Guidance, and domestic violence as more of the family younger units in town. So that being said, trying to balance it out in terms of the age spectrum in town. I mean, we're pretty well balanced with the families having more resources that the town does cover. But that makes sense. I mean, in terms of the population. So it's up to the commission if they want to look this over, mull it over and change up some of the numbers. I know, Harrison, is there a committee you want to look at it, or?
Well, I think right now we're pretty defined with the 174K. The other issue that's hanging out there, and I agree with everything you said, but the mental health issue is also something and worthy of consideration, especially COVID related. So that's, a last year, this year, next year, whatever.
Yeah.
However, we can look into the future with this. The other thing is the mega list that the town is looking at with the ARPA funding is Get About on that list, senior transportation.
Yes,
anything?
they have.
So we
Yes,
don't-
they've submitted.
No, they could be getting significant sources for funding from that. And a lot of those issues, there are 2 pages full of requests and recommendations and what have you, that they're weeding their way through to see what money goes where. So I think we can probably hold where we are for now and then revisit this in the future if we need to.
So I need to present this so the CFO, as you know, has taken another job, and so he's leaving. They're trying to start and fast forward to passing everything.
Yeah, is he staying till the end of the year or when does he
No.
leave?
This month.
Oh,
And
okay.
so they're pushing everything forward. So they're going to need an answer from the commission sooner than later.
Well, let's have, are there any more questions, suggestions?
Yeah.
If
Well,
not,
I guess
let's
my
move to-
only questions is, I think where Harrison was going with this, if they've made a similar request for ARPA funds in whatever, we probably
So
should
this
have
is
some
for-
provision in
yeah,
there.
This doesn't include the van. This is for purposes for running the
Yeah.
Get About.
Bethany, as I listen to these agencies, I don't even have a gut feel whether I would go up or down with these different agencies. So in other words, I'm not, if we were in a position to reallocate and give some more and some less, because we are working with a fixed sum, then I would like to go into it with a sense that, yeah, this one's gotten a lot needier, a lot more important, and this one less so. I don't even have that sense. So do we have any sense that maybe we're under or over supporting any of these organizations? And if not, then I think we should continue the support we provide. And I know in the case of Get About, their rides dipped down, but now they're up. And they've been dependent on the town for this 46,000 since I've been on the commission, I think.
I know the operating costs, yeah.
And they are the only transportation available to people who can't get around themselves. And that's a really essential service. And I mentioned that because I know it well, but the others are, I think, highly essential, notably kids in crisis, the counselor at the school. So,
I mean, it would be a huge blow for the Get About if we gave them less. Here we are, a town taking them over and then giving them less. But listen, the New Canaan Cares, all of this goes towards, I shouldn't say all, but educational funding to have educational speakers and things like that for the residents. They'll work with what they have and what they're given in terms of their budget. I don't know what they get from asking, if they ask the Board of Ed, some of the younger kids in crisis. I know the Board of Ed, is covering 2 years. New Canaan Cares, it's just status quo. I mean, if we give them less, we're probably going to have less speakers or less education and awareness.
Just to clarify, Alyssa McKenzie, we have potentially 5,000 more to give if we kept it in line with last year, right? We're only up to
Correct.
169. So we don't have to necessarily take any money from anyone if we wanted to allocate more.
Right. We actually have 5,000. I don't know if if you want to put it towards community program, mental wellness, make it 10. But we do have 5,000 to work with. Give everyone $1,000. I don't know. It's 1,000 really won't do it any big difference.
Rob, I saw your hand up there.
I'm not a member of the committee, but just a suggestion from what I'm hearing is you're putting a placeholder in here for your budget for next year, and you're having a discussion about how you would allocate it at this point. But you may want to suggest the total amount that this is adding up to, and this is what you're thinking of this is how you're thinking of allocating it, but it's giving you flexibility to give more, give less, or add new or subtract. It's really a placeholder really for your money, right?
Well,
For your
each of these
budget.
items is a line item, and that's the thing. And it's not. I hate
It's
to
a
go
line
paint-
item, but you'll have this is all adding to a total of a line item.
Yeah.
But throughout the year, you'll have some flexibility to make some adjustments, not to the total amount, but how you're allocating it to the various organizations. And that
The
way,
organizations need to know, though, they for their budgeting purposes, that's my only, and the thing is, 1 year, we did try to do a lump sum, and then deciding, so the agencies would have to submit each month when they wanted to use the money, and we'd have to decide for them, and that really worked against them for trying to line up speakers and things like that. They didn't know if they had the money. So, yeah.
Could we at least come, and I don't want to take any more time. I see Harrison's scratching his head, and so am I. So I'm wondering if we can't do the following. Can we agree on maybe the top priority, or the top 2 priorities? Take 5% off of all of the requests that have come in, and allocate those additional monies to what we consider to be the top 2 priorities. Make it that simple. It will not be that egregious, I don't believe, to each of the other divisions or departments, but we will have, at least as a commission, made a significant difference in one or two areas where we think are the highest two priorities. And so since I brought it up, I will go tell you that I truly believe, my three would be get about, domestic violence, Meals on Wheels, understanding that everything is extraordinarily important. All of these are important, but we as a commission still need to make, some priority consideration given where we are right now. And knowing that other like ARPA funds and the school board needs to step up in certain areas. So that's just one methodology that I would throw out there. But I certainly, all of these are very needed services in our community, and it is very difficult to make a decision with only $174,000 on which one should receive a higher priority than another. They're all great organizations.
Yeah, this is the allotment to the HHS, and frankly, it has been the same for a few years. We are dealing with inflation. Most of these requests are for more money than we actually allocate, I think, going forward. And we do get requests so to keep 5,000 in reserve is fine. We do get requests during the year, like the speaker, Emily Torsiano, who turned out to be a very positive force and influential person with the Sacs and high school population, with her experience with all sorts of issues, including media and et cetera. So I think keeping a little reserve is fine. And for practical purposes, as well as we don't know where the ARPA money is going to be going, let's just continue as we are. I appreciate all the comments, and they're all true and right on. And maybe next year we'll do different allocations. But I think for the time being, let's just stay as we are.
Do you want to take a vote on this? So
Yeah, let's and again, thank you for your comments, and they're important and long-term planning here. Yeah, let's have a motion to approve the draft requests as presented by Bethany. All those in favor?
I vote.
Aye.
All those opposed? One opposed, or aye? Listen.
Sorry, I had my hand raised for,
Okay,
before I approve.
thank you.
All right, thank you. I'll present to the Board of Finance with your
Okay.
approval.
The last item, which I don't think made it to the agenda, but it's the commission, and usually in December, we decide appointments, reappointments, et cetera. And at the request of the first selectman, this is all being bumped to January. He's looking at a number of issues here, and just FYI, if you don't know it, you probably do. So when you're appointed to a term, it's a 3-year term. And if you replace someone who has resigned, it's like last year was Alyssa. She was on the commission for about 2 months, and then her term was finished because she took Renate Dolphin's place on it. And this year it's Jen Hadlick, and she's taking, I think it's Judy Dunn's position. And Lance is also leaving. His term has expired. He's been on the commission for X number of years. I did write him a letter just thanking him for his service, especially in this alcohol and substance related arena, and we will miss him. And anyway, so this is, it's all the call of the selectmen, they have to acknowledge and approve these appointments, candidates, and if you have any forthcoming, because we will be looking for a few prospective members for the commission. And then it either goes to the Republican or the Democratic town committee. And they kind of clear it and move it on to the selectmen, and then they do the approving. So just forward that information if you know of anyone. And any other issues or questions about that?
How many new, because are we currently down a commission member?
Yeah, we're down 2, and it'll be 3. Moving forward.
Okay.
So we have 5 people on today's meeting. 5 commissioners, I think I counted it right.
Yeah, but plus we have Jim who's out. Lance,
out.
who has, his
Lance
term
is-
has come to an end, and he said last month that he was finished. And so then we will look going forward, and I think with Lance leaving, we'll need 3 new members.
Yep.
And if you have anything that you want to discuss about staying, resigning, continuing, questions, and also suggestions for candidates, please, you can email me. And thank you.
Thank
Our
you.
next meeting is going to be January 6th, continuing with the Zoom. And may I have a motion to adjourn?
Okay.
All those in favor? Aye.
Yep.
Okay, thank you. Happy holidays to
Thank
everyone.
you.
Happy
Everybody
holidays,
the best.
Harrison and the
Stay
board
healthy
staff.
and have
Well,
fun.
Happy
Thank you all.
holidays.
Happy holidays.
Thank you.
Thank you,
Hi,
everyone.
everyone.
Bye,
Bye.
I'm going to end the
Christmas.
recording now. I'll stop
Thank you.
recording.